directly perineum. Yes. So to understand this topic, actually, let's talk somehow about the perineum. How to talk about the perineum? How to understand this part? Because I know that somehow it's like making problems for most of you. To understand it so much quickly and so much simple, take this please. If this our pelvic floor. So now we are looking from above. This our pelvis and you are looking from here. So this will be our pelvic floor. So what can you see? In layers, the first layer it was here. It was this foramen, which we called it obturator foramen, which is this one. So this will be obturator foramen. It's covered by obturator membrane, but leaving space, which we called it obturator canal. Okay, so this obturator foramen covered by obturator membrane, and this will be obturator canal. Lining this obturator from inside, we have what's called obturator internus muscle. Again, from inside. Why I'm saying this? Because we have obturator externus, but forget about it, it will be lower limb. Okay, I need this. So from the inner surface we have obturator internus muscle. Okay, it will be lining this. So if this obturator foramen here, so here we have the obturator membrane, and it's covered by obturator canal, and here it will be obturator internus muscle. So this obturator internus muscle lined by fascia, which we called it obturator fascia. So this muscle, it will be covered by fascia, which we called it obturator fascia. Okay, so what happens for this fascia? Now we have this obturator fascia and this obturator fascia from the other side. So here the fascia, it makes like a line, second line. We called it white line because it appears white, or tendinous arch. So the fascia itself, it comes here and it will be like much more thickened to be like this. Can you see the paper? It was like straight, and now after forming this, is this straight anymore? No, it has like elevation. This elevation in the fascia, we called it white line or tendinous arch. Same here. So the same happens here. This elevation, we called it white line or tendinous arch. It's formed by the obturator fascia itself. Why? Because here it will be the origin of another muscle. Which muscle? Excellent. Levator ani muscle. Why you are not cutting this, please? So this, it will be levator ani muscle. So where it comes from? We said this, our pelvic floor, like this, and this obturator fascia, which forming this line, which we call the tendinous arch. So from the tendinous arch on the right side up to the tendinous arch on the left side, we have the origin of levator ani muscle. So it will be this. So now what we have, this is the area of the true pelvis. But here, can we see this space? This is perineum. So anything down to the levator ani muscle, up to skin, this which we called it perineum. Okay? Anything above levator ani, it was true pelvis. Anything above the level of terminate line, we will talk about what this terminate line, it will be false pelvis. It's okay? So again, look at here. Can I take this, please? Thank you so much. So here what we have, this is a hip bone. And where is the sacrum? It will be like this. And they articulate to form sacroiliac joint, like this. So this will be the sacroiliac joint, and of course we have another hip bone here. Where is the terminate line or terminal line? Starting from symphysis pubis, going with pubic tubercle, arcuate line, ala of the sacrum, promontory of sacrum, ala of the sacrum, arcuate line, symphysis pubis. So all of this terminal line, like this, which means this is your landmark. Where is false and where is true pelvis? The upper is false, in spite of it's greater, but it's false. But here it's lesser, but it's true. So even this true, it will be subdivided. By what? By this muscle, which is, of course, this is too big now, by this, which is the levator ani muscle, like this. So anything above the levator ani muscle, it will be still true pelvis. But anything down, now we are looking from here, it will be perineum. It will be perineum. So the perineum is the space between skin and superficial fascia up to levator ani. Is it true? Okay, let's continue. So we said this will be the perineum. It will be like this. And here we have this, which is levator ani muscle. So this perineal space itself, it will be subdivided. Subdivided by what? By imaginary line, which passing between the two ischial tuberosity. By imaginary line, which passing through the two ischial tuberosity, this area. Okay? Divided to be what? Two triangles. What these two triangles? Let's remove levator ani. So this two triangles will be anal triangle behind, and this urogenital triangle. Anal triangle and urogenital triangle. So anal triangle from where to where? From the coccyx up to the imaginary line. And here from the symphysis pubis up to the imaginary line. Anal triangle, why we called it anal triangle? Because it has anal canal. So what this space in between? What this space between or in each side of the anal canal?
SQ anal fossa.
Excellent. SQ, because this is what? Ischium. Anal fossa or SQ rectal fossa. One of the first topic. That's why we said it starts by perineum. That's why we have to talk about all of this. So this will be the meaning of SQ rectal fossa. Here and here. But here, urogenital triangle. Now do we have fossa? Actually, no, because we have here many spaces. Why? Here it was only for anal canal, which is wherever male or female, this triangle, it will be copy-paste. Either male or female, which means if you cover this area, you will never know if this male or female. But here, this will be the urogenital system. So here it will be the difference. So that's why this area, it will be subdivided. Again, it will be subdivided. How? It will be by this. If this levator ani muscle, let's make it by one single paper like this levator ani, and this will be membrane. We called it perineal membrane. This we called it perineal membrane. So perineal membrane, it will subdivide the urogenital triangle into two spaces. Can you see this? Still levator ani and this perineal membrane. So please help me. Put your pen inside the superficial perineal pouch. Deep. Very good. So this will be the superficial perineal pouch. Very good. And above, deep perineal pouch. Why? It should be the opposite, like she said. Actually, normally, it should be the same like she started. Here it will be the superficial and here it will be the deep. No, it depends on the dissection. During dissection, you are dissecting from skin and upwards. So this which you meet first, and this you meet deep. Okay?
Is this the levator ani?
This is levator ani, and this perineal membrane. Perineal membrane. So please put your finger again. Yes. So what will be this? Superficial perineal pouch. So what will be its boundaries? Superficial perineal pouch. The roof is perineal membrane. The floor is skin. Very good. On each side we have obturator fascia. Excellent. Deep perineal pouch. Show me please. Now the roof is levator ani. The floor is perineal membrane. And on each side you still have obturator fascia. Still you have it, but just it needs to be more closed. It's okay. So this, it will be the spaces. It's very, very important. And this again, only in the urogenital triangle. Only in the urogenital triangle. Very good. So now the first topic, it was anal canal and the anorectal fossa or ischiorictal fossa. How to talk about this? We said that the pelvis now, it will be subdivided, or perineum, it will be subdivided to urogenital and anal triangle. So let's talk about the anal triangle and what will be the contents. If this, look at here, this perineum, so this will be the urogenital triangle and this anal triangle. So on each side of the anal triangle, we have this space which we called it ischiorictal fossa. So what will be the contents of ischiorictal fossa and the boundaries? First, the boundaries. Anteriorly, what you have the posterior border of perineal membrane. Posteriorly, what you have? Coccygeus muscle. Medially, what you have? Anal canal. Laterally, what you have? The ischium, while it was covered by obturator fascia. So again, we said here, this is ischiorictal fossa. This one, forget about perineal membrane now. So this, it will be the levator ani muscle. So here we have the anal triangle, and on each side of the anal canal, we have the ischiorictal fossa, this space. So if I told you, please describe this space, how to describe it? Anteriorly, what you have? The posterior border of perineal membrane. Posteriorly, you have the coccyx and coccygeus muscle. Medially, you have the anal canal itself. Laterally, you have obturator fascia, which is covering the ischium. And the obturator fascia here, it makes something so much important. How? Obturator fascia, in this area only, it makes canal. We called it pudendal canal. It will be like this. Only in this area, yes. So it will be only, this is a canal. And here it stops. So can I see only this will be the pudendal canal. Why it stops here? Because it's not continuous up to the urogenital triangle. It's only on each side of anal canal. Formed by what? What this pudendal canal? Fascial canal. Comes from the fascia. Comes from the obturator fascia itself. For having what? What this pencil? Internal pudendal artery and external pudendal nerve. Internal pudendal artery and pudendal nerve. They are running here and even giving branches. Which branches? While it was running here, internal pudendal artery and pudendal nerve, they are giving inferior rectal because we said this rectum. So here it gives inferior rectal artery and nerve. And what else? Posterior scrotal artery and nerve. So it gives inferior rectal and posterior scrotal. Inferior rectal, it stops medially like this to reach the rectum and the anal canal, but posterior scrotal, it needs to reach scrotum, which is outside the body. So it has to go to the urogenital triangle. In which space? Deep or superficial? Superficial. To be more superficial, to go outside, to reach the external genitalia. Posterior scrotal, or in females, it will be posterior labial, same. Posterior scrotal artery and nerve, and posterior labial artery and nerve. Really, is it clear? So these are the contents even of the ischiorectal fossa, not only the boundaries.
canal is in the ischiorectal fossa.
Inside, yes, the lateral wall of the ischiorectal fossa, forming one of the boundaries. One of the boundaries. Look at here. This is the ischiorectal fossa. So medially you have the anal canal. Inferiorly you have the floor, which is formed by skin and superficial fascia. Superiorly you have the levator muscle, the roof itself. And laterally here you have the obturator internus muscle. While it was covered by obturator fascia, while it was slipped like this, it's divided to form pudendal canal. So pudendal canal, it will be one of the contents, and also you can see that it's forming the lateral wall. Very good. What it has? Internal pudendal artery and pudendal nerve, and giving which branches? Inferior rectal nerve and vessels, posterior scrotal nerve and vessels. And also we have perineal branch of S4 to supply the skin of this anal triangle. Perineal branch of S4. What will be the contents? Ischial bed of fat for having all of this. So this will be the ischiorectal fossa. What else? What is it?